going on, everybody? Welcome back. I took a little bit of a break because I've been working a lot and haven't been able to play. So I'm excited to be back, and we get a call. This is going to be episode 14. I'm back on track. We're going to finish off Amon Heights on this episode. Uh, so we got unresponsive, very close by. But like I said, this will be the last episode, I think, in Amon Heights, or at least to unlock the next map and set of calls, which I'm excited about because the next set of medications and treatments we're going to unlock, I think, are going to benefit a lot of the patients we've already had. I just don't have the ability to use those medications until we get them. So I'm excited to do that. This should be a pretty straightforward first call. Oh, yeah, you know what? I realized I did not even have my sirens on. That's my bad. How do we... Oh, okay. I remember kinda how to do this. Kinda. Yeah, you know what? I'm blocking traffic. That's fine. We'll just take the stretcher down there. We've picked up from this location before, so... Oh, will it not let me grab the stretcher? Do I have to come down here first? I could probably take the truck down there. There. I think since I hit that area, I should be able to grab the stretcher now. I think there's also a... Yeah, okay. I think there was also a faster alternative to get into this patient from the bottom, but whatever, we're here. So I hope you're all having a wonderful day. It's been a bit since I've been able to play. I work 3 days, sometimes 4 days in a row. So I don't have the ability to usually play when I get home. I'm just tired or I got other stuff to do, as many of you do. Same kind of lifestyles. So I'm not going to waste my time. Hey, this time we have a shopping cart at least with some boxes. What looks like a bazooka. I don't know what that is. Seriously, is that a giant flashlight? It's, that's quite comical. It's bigger than him. Oh, we have a naked woman. This could be absolutely serious. Not so much life threatening wise. I shouldn't say that. This could be life threatening, but I mean like
They probably have taken too much of the drug.
this could be a sexual assault. This could be who knows. Do you know anything? All right, yeah, get over there. Can I ask you something?
I don't know. I just felt pity for that person. Just
Oh, it's very good. Can I talk to you?
Something is wrong with me.
Okay, let me back up because I'm up in your face here. Uh, Tell me what happened.
Stuff.
Okay, so we have a homeless individual. I'm not going to ask a stupid question like a blanket or jacket.
I'm starting to feel better.
I was hoping this game again would get patched soon. Any chronic health conditions?
I think so.
Okay, I'm not really going to ask any other questions. I've come to realize that asking really doesn't do anything. It doesn't affect anything like in real life. Like they're not going to tell me, oh, I take this medication for this condition, or hey, I'm allergic. That's a question they don't ask on here. And somebody else had commented, and they were like, hey, how come you don't ask allergies to your patients? Well, two reasons. One, I can't. It doesn't give me the option to. And two, again, I can't. Like that's it. It just does not let me ask that question. So that's something we ask all patients as part of the 6 rights for medications, right? Right patient, right route, right dose, right time, like right situation, right documentation. So you want to make sure you're giving the right medication to the right patient, the right moment, in the correct way. So this person immediately, we're going to do this. I guarantee you she's going to be cold. She's shivering. It's terrible that, like that. Yeah, hypothermia. We can fix this really simple. Let's just go ahead and elevate the temp, get the heat blowing up on her. She's very cold. Um, Get a blood pressure on her. Surprised she's not, you know. That's good. That's really good too. Let's check her sugar. You know, she is homeless. She's not getting the correct meals. She's probably not getting any meals. Okay, good. Actually, sugar's fine. So that's good. Listen to your lung sounds. Well, that's clear. Unfortunately, I don't hear anything, and
I
it's
feel like
just
the room
it's
is
just
spinning.
clear. Let's go ahead and give you an IV here. You got great veins, lady. Great veins. We would give somebody else had introduced it like, hey, would you give warm saline to a patient that's hypothermic? And I was hypo. And I was like, probably not. I would just put him in a warm environment. Introducing warm saline to a patient isn't always the best thing to do. You have to do it in a slow and steady rate. You're not going to do it fast like this bolus that they do here. It actually can cause issues. So you want to do everything in a controlled pace. For this lady, unfortunately, I don't have an option for a blanket. So we're just going to go ahead and take her to the hospital. Everything else is fine. I didn't see any bruising on her, no issues. It's literally just, what's this saying? What's this? I don't know. Oh, hypothermia. Yeah. No, she's a hematoma. Whatever. She probably fell. This is just an exposure. That's all it is. Let's get her going. This would be a non-medical, like nothing emergent, no lights and sirens. But because pedestrians just like to jump into traffic on this game, I'll leave the sirens on. Let's go ahead and get her over to the hospital. So where I live, we don't have a lot of hypothermia cases. It's very warm. We do have a lot of hyperthermia, so you'll have a lot of heat stroke, heat exhaustion, heat-related incidents here where I live. Those can be absolutely detrimental to your health if not taken care of very quickly and carefully. It goes again, like somebody is hyperthermic, you do not want to cool them off too quickly. You don't want to do an ice dunk bath that they do, or you might have heard of. You can cause seizures and all sorts of other issues. You gradually want to lower the temperature and increase the temperature on patients like these.
We take over from here.
So it's an A. I don't know what more I really could have done for her. I'll be realistic. She seems confused. Noise sensitivity. I'm not really. I mean, I would try to make it a quiet environment. Maybe transporting without the sirens would have benefited her. I don't know. Being realistic, this game's a little janky. I enjoy it, but it is janky. Oh, we already got one. Cool. Not too far. Also.
To ambulance 152, we need immediate response. Alarm for ambulance 152. Person has trouble responding to the caller.
Okay, we have a potential overdose. Could be hypoglycemia. Those two things go hand in hand. So do strokes. A lot of hypoglycemic people are mistaken for strokes, and that's why we have to check sugar on these people. Hypoglycemia can mimic a stroke, so it's important to check these things and check these boxes. Don't get tunnel vision whenever you're with a patient. Check all of your little boxes to make sure you're doing the right thing. This is just a supposed overdose. Doesn't mean it's an overdose. In this game, it pretty much is, but in real life, you can't just assume. That is not great. All right, we're here. Let's go ahead and cut it this way. We've been here before, too. This is like the overdose club. So yeah, I'm very excited about unlocking the new city. getting a bunch of cardiac-related calls, which is something I enjoy. Oh, this person's sitting up. We'll ask some bystanders. We'll take a look. I think I see... it slows down at a snail's pace here. See some... I don't know. I see a water bottle. I see towel.
Like MDMA. Probably an overdose.
Where? Okay. Oh, I didn't want to ask you to move. I'm sorry.
Just some MDMA, as always.
Oh, just nonchalantly. Cool. All right, cool. Gotcha. We got some mydriasis. We got rapid eye movement, hyperapnea. Okay. His legs look a little blotchy too. Like a little mottled. I don't know if you guys are going to be able to see it on your screens the way I do, but he looks a little mottled, but not his face or his arms. His arms look fine. Let's
The
see.
left lower leg. It's painful.
I bet. It sucks.
We should dance.
All right.
Who cares? Let's enjoy the night.
Okay. The only two questions I'm going to want to know is what's your
There's
health
only
history?
One recurring fever every Saturday night.
Cool. And I just want to know if you take any medications.
When I'm partying, usually.
Cool. All right. And I assume they're not prescribed. Okay.
That feels better.
Great. Let's get you in the truck. Let's load you up. Let's get you the hell out of here. I wish I could do a lot of the treatments on scene. You know, or I could tell my partner, like, hey, can you go start a line? I also wish we had a cardiac monitor with rhythm, so I can kind of see rhythms. Like, all it's giving me is a heart rate, so I can tell if they're, you know, bradycardic, you know, tachycardic or whatever. But I can't see if they're having PVCs. I can't see if they're in, you know, first degree, second degree, third degree, anything like that. So these things, they are important, especially for, you know, amphetamine overdoses. They'll be tachycardic, but they'll be throwing PVCs out the, you know, the wazoo. He's not tachycardic, by the way. I don't know why it's saying that. He's 99. He's 100. Still not tachycardic. So now he's tachycardic per se, 101, but he's flip-flopping back. I don't even know if I want to give this guy Ativan to chill out because it might chill him out a little too much, but we'll do it. Sugar's fine. That's fine. He's chilling. Let's go ahead and listen to the lung sounds. Knock that out. Sounds good. Yeah, sounds really good. And let's go ahead and start a line on him. I'll bandage his leg up too. It's just a hematoma, but I don't know what the game wants me to do anymore. We'll start a line. Let me go to the bandage. Let's go. Let me look at his legs. Actually, can I take the shorts off? Yeah, I can.
Cold.
Oh, you're cold, but you're very warm. So this is probably going to be an incorrect treatment. But I'll bandage it up. It's just a hematoma, which is a bruise. That's all it is. If anybody tells you they have a hematoma, they're just being extra. Yeah, let's go ahead and give it to him. I mean, it's part of the treatment plan, and I want to get S ratings for the points so I can unlock the next area. But I probably wouldn't.
I feel like the room starts spinning.
I wouldn't give it to him per se. I'll go ahead and throw him on oxygen too, just for the sake of it, and we'll get him going. Cool, you're done, bud. Let's mark this as a substance. Oh, he's a little bradycardic now. I mean, hypotensive. I apologize. We can fix that really quick. Let me just jump back in. 2 seconds. 2 seconds. Let's go ahead and take care of that because red's not going to give me a good point system here. Technically, he didn't need the Ativan. But like I said, it was going to chill him out too much. But this will at least put him back in yellow. Rarely do we bolus saline. We'll go ahead and hang it in a bag. We'll pressure bag it if need be, so it goes through. But very rarely do we just bolus There's been like 3 times in my life where I've filled like a 60 cc syringe to give it to a patient, like rapidly to get their blood pressure up. Now we have other things that we could tend to give them, other medications. We'll give them, phenylephrine. We'll give them Levophed, which is what we call a pressor, vasopressor, to get the blood pressure up. But if you place patients on pressors or blood pressure medications too long, you'll turn people into chicken nuggets. And what I mean by that is they'll lose their fingers, toes, eventually their arms, their legs, because what it's doing is squeezing your vascular system so that blood can get to target areas, right? Keep your core organs alive in your brain, but sacrificing your outer circulation, let's just say like your peripheral circulation, your fingers, your toes, your hands, your palms, your feet. So you'll lose them. They just die. They don't get circulation. They don't get blood there, no oxygen. So they just die. And then they eventually get amputated or fall off, actually, kind of like diabetes. Look at that. Well, I think the bandaging was the incorrect treatment. I don't think I'm supposed to bandage, or maybe the Ativan wasn't beneficial to him. I don't know. I'll take the S, though. But yeah, anyway, they turn into chicken nuggets when they're in the ICU for too long. I apologize if that's rude, but they do. All right, so far 2 calls, A and an S, 500 points. I think I need 1,000 or less to go to the new area. I don't think it tells me on the map. But I got to be close, unlocking the new area, a new set of calls. But we do have 2 new calls anyway. We have a Swift aid, and we have...
Respond, ambulance 152.
I can't remember what the other one was that we unlocked, but...
Ambulance 152. We're getting something inside a local city park nearby. Patient is reported not breathing.
Not breathing?
Report an accident with 1 person involved.
That's not good.
The location is being sent to you at this moment. Move quickly. Over.
Well, hopefully somebody on scene, if they go, don't have a pulse, knows how to do proper chest compressions. God, I suck with the siren today, huh? This is going to be a far drive for a not breathing patient. This might require some surgical interventions. We'll see. If they can kind of talk, I'll just pass a tube. If they can't talk, we're going to have to crike. And I think that's the way I'm going to treat this scenarios from now on, because it gives me the option to crike. But if somebody's like, I can't breathe and it hurts, then I'm probably just going to intubate them. I don't think the game will tell me I can't pass a tube, because I can't crike in the ambulance, which is a little weird. I have to do it on scene. So we'll see. We'll see what happens. That's something I wish this game had, was like hydralazine to lower the blood pressure, or, Neo stick to increase the blood pressure. But that would be a lot, and it's not normal 911 medications. Hydralazine can be a normal 911 medication. Jeez, I wish I could get on that free clear side, but nobody let me through. I can pass these 2 box trucks. Hey, that works. Getting there. We're getting there. This is not ideal for a can't breathe patient. I just want to say I didn't hit 1 car.
Check them out.
We're going. We're going. I'm going to go to the second area and back in.
Hey, keep your eyes open.
I'm good. Okay, really quick. Stretcher, he's up, so he must be doing something. What do we got? What do we got? What do we got? I see tiny foods, tiny grapes, tiny grapes. Reduced air hunger, unresponsive, so he's not going to be able to talk to me. This also could be an allergic reaction to something he ate. Is he able to talk to me? He's not able to talk. So we are going to go ahead and we're going to go ahead and correct this patient. We got that. Let's go ahead and throw a seat collar on him too, and let's get him into the ambulance. Currently, Old Town Road. I don't know what that means, but we'll get him in there. We'll get him hooked up to the ventilator. Number one, ventilator. He's out of it, so. Surprisingly good. Normally now I would give medications too to, further sedate, give pain management to the patient because we just cut his trachea open, essentially put a tube inside. Well, now his blood pressure's up. I will treat him. I will treat him. I like that. Let's listen to the lung sounds. It's clear. I'm going to assume that's clear. It just says red, like not clear, but I think it's because I cracked him. So maybe it means it wasn't clear, but now I gave him an airway. Cricothyroidectomy. So we got a line in. The last thing I'm going to do is I'll hit him with a little bit of morphine for pain. It's not part of protocol for this game, but you want to give them something for sedation and pain. His blood pressure is high too, so this will help lower that a little bit. And I think that's it. I'm not going to give him glucose. He's fine. We'll mark this one very quickly to a airway substance. No, it was airway, and it was an object in the airway. Now it's saying there was no airway. Substance, opioid overdose. No. I'll take the L on this. That's fine. But this was an object in airway. Oh, God. It wants me to do opioid overdose. But I'm going to disagree. Do I have Narcan? Can't hurt. I don't think it was, but whatever. I don't think it was. His heart rate, he wasn't hypotensive. He wasn't, bradycardic. I don't think it is, but the game wants me to go that way because of the symptoms. But that's not correct. This was a object in an airway. That's all this was. We'll see what it says. I really think it's just respiratory. It was an object stuck. But like I said earlier, don't get tunnel vision. I might have gotten tunnel vision where I'm like, cool, breathing problems. Here we go. Like there's grapes, there's all this other shit on the floor. Let's crike them, get them going. I'm going to stick to what I said.
Please strike one here. Think of our patients.
I do think about our patients. That is a big bump. I do apologize for that. Okay. Yeah, I'm going to disagree with it if it says it was an opioid overdose because of the symptoms. I don't believe it. I really don't.
Let me see. We take over from here.
I do not think it was. I still stick with that. I mean, I got an S, but it is saying coughing up blood, difficulty swallowing. Like, I don't think it was a substance abuse. I disagree completely. But it's what it wants, so whatever. I'll take the S. That alone should have unlocked my the next map.
Ambulance 152, high priority dispatch. Acknowledge. Alarm over. For ambulance 152. We received a report of a severe accident in the vicinity.
Ah, right back to where I was.
Several workers were present. Prepare for multiple patients.
Oh, okay.
Some sort of blast happened on a small construction site. Reason unknown.
I'm gonna go straight.
Location sent. Move quickly. Over.
I think we could take that tunnel through the mountains this way. At least I thought I could. I might be wrong. Yeah, I'm wrong. Whoops. We'll just go the way it wants us to go.
Just a small bump. Should be fine.
This might be the way. Yeah, this is the way. This is the way. Okay. Okay. I just was on the wrong street. This is just a faster, easier way to go than the other highway. Hitting our top out speed. All right, realistically, we don't need that. All right.
Check them out.
I'm not lost, lady. Oh, geez. Okay. Bear with me.
Just a small bump.
Yeah. Expect several people. I see one guy. That's easy then. Let's turn, pivot, pivot. That works. Okay, hey, what do we got? He's looking at me. That's a good sign. Pale skin. That could just be him. I don't know. Inflamed, red blisters. Okay, so we got at least a 2nd degree burn because of the blistering. All right, bud. Hey.
My left lower leg's injured.
Yeah. Okay.
My skin is so warm.
All right. We already know what this guy's gonna say. We'll listen to it. Oh
My
gosh,
skin feels incredibly warm.
that's what I get. Okay, I'm gonna tell him to calm down.
I'm
Meds,
starting to feel
history. That's all I'm gonna ask. I don't need to know what happened. I know what happened.
No, nothing like this. Just occasional back pain from work.
Right.
Just some painkillers a few days ago for a headache.
Sweet.
Nothing else.
Sweet. Awesome. Let's get you going. That's a normal size flashlight over there. The other one was comical. All right. We're going to get in there. Vitals, bandage, IV, morphine, go. That's it. Oh, shit. I didn't see a stomach. Okay. Ooh, that is a burn. I'm going to do everything on this arm. Makes it easy.
Please give me some space.
No.
Temperature is going down. We're back to normal.
Okay, good. I almost missed that. Uh-oh. Okay, let's go ahead and really quick, I'm going to give you something for pain because I'm going to bandage these things up, and that's going to suck a little bit. He's going to get a little hypotensive, but that's fine. I'm going to give something. Technically, our blood pressure is fine.
This feels amazing.
Yeah. So we're going to bandage those up, but his blood pressure is going to drop.
I'm beginning to get a headache.
Yeah, that's fine. Could just be a side effect. Let's do burn dressing. Keep it in the lines. The torso is like a bitch to wrap. Well, my gloves didn't get bloody on the back end, which makes me feel like there's nothing there. Nope. I'm gonna go down here. Yep, we're gonna burn that. That looks like a 1st degree, just a superficial, they call it now. Just like a sunburn, right? Anytime you get a sunburn, technically have a superficial burn. Let's go ahead and do that other arm right here. That's black and a little charred. Usually you would see bone, and I don't know if the game's going to show that. That might be a 3rd degree for the game. Usually 3rd degrees are painless because it's burned through all the nerves and everything. Terrible. Absolutely terrible. I'm going to throw him on a little bit of O2, just get him going. His heart rate, his blood pressure, everything looks really good. I think we're done here.
Getting hungry.
I don't know what to tell you. That remind me, let's check your shuggy. Your shuggies. 61, that is why. Okay. Well, that's low. So we will give you some glucose. Take that off really quick. I've never seen intranasal glucose before. That's new to me. I've never seen that. That's a new one for me. I'm okay with them being hypertensive. That's fine. Tachycardic, he's hypertensive, but really that blood pressure is okay. The heart rate is even fine. It can keep going up. I'm cool with it, but I give him the morphine. It doesn't wear off that fast, so I might be doing things a little too fast for the game. As I'm treating it like I would really do it on somebody.
Strike
Damn,
carefully.
I always hit that wall. Let's go. These trucks are pretty realistic. I'm not gonna lie to you. Oh, traffic here is not bad at all. That's perfect.
Please strike more carefully. Think of our patient.
His heart rate is getting a little high. Nothing of a concern. I mean, he was just burned. He's going to be losing fluid. He's going to be in pain. I mean, I could hit him with more morphine. If she says something, I could be like, give morphine. He needs, his temperature is also going down, so that could be why his heart rate is increasing. It could be perform tracheotomy.
I'll handle it.
By the time we get here, it won't be active.
Patient's running out of time.
I don't understand that term. Running out of time.
Let me see. We take over from here.
Got a B. I did apply bandages. It's always going to dock me for some sort of shit like that. But it is what it is. It's 900. If I hit 1,000, I'll be happy because I'm pretty sure the 1,000 is what's going to unlock for me for the new stuff. Okay.
Alarm for ambulance 152. Get ready.
So,
Unit 152.
house fire. God, the whole neighborhood sucks.
For an urgent call. Confirm receipt. Over. We have a residential building reported burning. There might be more than one person in the building. Be prepared for smoke inhalation and burn victims. Transmitting the location now. Hurry up. Over.
All right. I just hate driving to this neighborhood because it's such a drive. Yeah, I'm not taking the highway. I'm going to make the right. I'm going to take the tunnel. It's so much faster. So much faster. Less traffic. And I could shut that off. Yeah, look at all that traffic. There's just trash in the road. Did my ambulance just break down? That would be pretty realistic. I'm not gonna lie to you guys. If it just breaks down on the way to a call. Yeah. Okay, we're gonna cut left. I see all the traffic, so I assume we're probably not the first ones on scene. Oh, well, it's not here.
Just a small
Oh,
bump.
good. Good, good, good. Up here, I see 1, 2, 3. We got 3 here. Let's check out this first one and see some blood. Injury to the leg. Patient's losing blood. I noticed that. There's the strong bleeding. Somebody coughing in the background. Not her, but she's not really talking to me either. It just looks like a bleed. While I'm dealing with everybody else, let's go ahead and throw a tourniquet on that arm. She would be screaming in pain now.
I injured my right lower leg.
Okay.
My skin feels like it's still burning.
Okay. You're talking to me right now. I'll put you as a yellow. What do you got? I see blood under him too. Patient's losing blood, rustled breathing, blisters to the arm, so he was directly affected by it. Uh, underweight. Okay. That's fine.
It hurts to the core of my body. My skin feels like it's still burning.
All right, that's cool. Right now, I'm also going to mark you as a yellow. What do you got? Coughing, rattling noises, difficulty breathing. That's a red. Okay. You're probably going to be the person I take. Looks like you got a lot more going on. You're definitely red. So we're going to go ahead and triage you red.
Hurts to the core of my body. My chest feels tight.
Okay.
I think I inhaled too much smoke.
Okay, calm down.
I'm starting to feel better.
Nice. Okay. The thing I want to know, meds,
I have
health.
scented candles are my preferred method of treating headaches. No, I don't have faith in modern medicine.
Well, you're going to get some, lady. I forgot to grab the stretcher. She's going to be the one I take. I think it's obvious. Sneak by. We're going to snag you. Load her up. I guess I could have parked up there. That would have been fine for next time. So that way we don't have to do this obstacle course. Yeah, because it's going to be a bitch to get out of here now. Okay. Let's see what we got here.
I feel better now.
No, her color looks good, so. That cough sucks, but I just throw you on some oxygen. Everything looks normal on her. I'm not going to go ahead and attempt an intubation. You know, she sounds like she has some rhonchi, crackles, whatever the game wants to call it, but I think it's rhonchi. It's not normal. We'll throw you on some O2. Okay, and then we'll go ahead and start a line on you. I don't think I'm going to push any medications. There's no need. I'm going to just set it to 80, and then we'll leave it there. I'll check your sugar and get you going. That's all I'm going to do. 72. I'm okay with 70. Hopefully the game's okay with it, but if not, new evidence. Normal. Okay, so... What does it want me to... Oh my god. Here. There. That's all I'm going to do. By now I should know where I'm going, but I like having that on just in case. I listed her as red. I would change her now to yellow. I don't think she requires a red. That blood pressure is going to start to come up. The sugar is normal, like 72 is fine. She's going to cough. She inhaled smoke. We don't intubate. Oh my God, this wall. We're not going to intubate every single smoke inhalation patient unless they're actually having increased, shortness of breath, difficulty breathing, inability to swallow is a huge thing for like a singed airway. You can develop swelling. We'll go ahead and start looking into that. I'm afraid if I hit another car, it's going to total. So we got to be careful on this last one. But it looks like everything's starting to normalize on her. The fluid's probably working. I think if I would have intubated her, I don't think the game would have docked me points, which I have an issue with because this lady, she's fine. She's definitely the priority patient out of everybody on there. Got it. Whoa. I didn't do that. I'll take my A plus, maybe?
Let me see.
Holy shit, at S. I'll take it. What was the wrong life-saving intervention? It didn't say... Oh, I didn't select anything. And I still got an S? She's hemorrhagic venous bleeding. He's hemorrhagic venous bleeding. That's fine. That's all okay. I'm fine with all of that. So I'm content with that. Let's see if we unlock... Oh, no, I need a significant amount more. Okay. All right, so it won't be this episode, unfortunately. It'd probably be the next episode. I might continue playing. I don't think I'll upload the next episode. I'm just going to try to grind through and unlock to the next map. If I have any interesting calls, I'll go ahead and upload the episode. But if it's just a random bullshit, then I'm just going to keep going with it and try to get through it to get to St. Joannes. See what we can do. But that is the episode, guys. I appreciate you guys watching, supporting it. I'm loving the engagement. Ask me questions if you have any questions. I'll try to do the best I can. I'll never lie to you. If I don't know the information, I'll go ahead and read up about it and I'll try to give you an answer to it. But I kind of want to, use this to also help educate me a little bit more and my treatment plans and stuff like this. Because these calls that I get here, I do get in real life too. So it helps me. I'm not saying the game's correct, but the game's not that far off, I'll be honest with you. So I will talk to you guys later. Thank you so much, and I'll see you guys at another time. Bye.